feel scared to death. I feel like if I go to sleep, I'm going to take my last breath. I feel like I'm in a death camp, and I'm trapped in fear for my life. Do you know how it feels to think at any given moment you're going to be left for dead? Literally, to die in a cell.
When the transfer happened, which was May 31st or May 30th of 2020, almost immediately started getting calls from inside about the outbreak happening.
What had happened was shelter in place started, and all of us who knew anything about prison were like, could just see, the train wreck ahead. It was like a matter of time. It was like a race against time. That was what we knew that when COVID got in, that it would be devastating.
Both North Block and West Block are filled with elderly and chronically ill people. And I just want to be clear, if COVID begins to spread in those units, there will be death.
We were getting real-time information because of relationships that were pre-existing. For me, the biggest takeaway is you can't build those relationships in the moment of urgency of a emergency. You have to have them going in order to really be effective in mobilizing. And so that's how we came together. And our goal was to just amplify and share out what we were hearing from people inside. And anytime we could, connect people to people inside so that people were able to speak for themselves.
We should not have 800 people living in a building that's designed for 400. That's 200% of design capacity.
The strategy was to raise awareness about what people were experiencing, to get as much information as possible out about the way this was, how dangerous the situation was, that CDCR's narrative that they had the outbreak under control was categorically false, and that if something urgent wasn't done, lots of people were going to be sick and possibly die.
If you're not motivated by a plea to the humanity of incarcerated people here at San Quentin and across the state, just know that the correctional officers, healthcare workers, and staff that are coming in and out of the prison daily could be potentially bringing infection into the community.
We know that there is no amount of PPE, there is no amount of face masks, there is no amount of sanitizer, there is no floor distribution plan, no bunk bed distribution plan that will keep our loved ones safe during a global pandemic while they are locked in cages.
Ultimately, I feel like we all knew that it was above us, and it was more than San Quentin. It was beyond that. It was prisons, jails, ICE detention centers across California, and that we knew that the visibility that San Quentin had was a moment that had to be used as a catalyst to politicize folks across California, politicize the media or whatever, and get them to start recognizing how inhumane it is to incarcerate folks during the pandemic.
It took months to get masks. It took months to see the doctor. Our lives were not prioritized. We know, the whole system is fucked up. And we knew this before the pandemic hit. We knew that we were housing human beings in kennels, and we didn't care.
For me as a public health professional, I call into question the entire system of incarceration as a fundamental threat to public health, because I firmly believe that incarceration is the driver. COVID-19 or norovirus or other infectious diseases are just the vector, right? Just the disease of the day or of the year.
I don't feel like COVID killed us. I feel like overcrowding killed us. But when you line up incarcerated people like dominoes, if one of us get it, all of us get it.
They need to be out with their loved ones. I can take care of my son. Yes. I can take care of him.